When it comes to helping a victim of sudden cardiac arrest, not all automated external defibrillators, AED, are the same. The DEFI-5S AED assists rescuers with real-time instructions and user-friendly. The Meditech DEFI-5S, which is recommended by medical professionals, has a pediatric mode button to reduce power to children and prevent burns to the heart muscle. LED indicators help to follow the instructions. Infrared for data transfer to computer, 2 languages to choose from. 5 volume levels so you can hear the voice clearly and use the device anywhere. The DEFI-5S has a daily, weekly and monthly self-test to help you determine whether or not the AED is ready for use. It comes with an AED carry bag that allows you to use the device without taking it out. It has a compartment for the first aid kit and a secure compartment for the AED electrode socket to protect it from water and dust, as well as reflective signs for use at night. A computer software DEFI-Soft which comes with device displays status information that can be accessed during DEFI-5S use, such as the time of the event, the description and the patient's electrocardiogram. The language of the prompts and the volume can also be changed through the computer software. Let us take a look at the AED DEFI-5S. The communication port, an infrared port for data transmission to the PC. Status LED indicators, it helps to follow the instructions. Shock button, prompted to press when fully charged and flashes red. Out speaker, for guidance prompts. Mode button, to select power range for child mode or adult mode. Hand carry, for comfortable carrying and easy gripping of the AED. On-off button, to turn on the device on and off, and connect AED to PC. Electrode socket, for connecting the electrodes to the AED. Visual instructions, to guide and help step by step. Hard cover, high strength, lightweight and provides elasticity and resistance. If someone is unconscious, you must first check if they are breathing and responding to stimuli. If he does not respond, you should immediately call the number of the emergency service and indicate the case and his location. Pay attention to the movement of the chest and listen to the sound of breathing, then feel the air coming out of the mouth. Check the casualty's pulse by placing the index and middle fingers on the neck next to the trachea or by placing the 2 fingers between the bone and tendon over the radial artery. Start CPR as soon as possible, because after 10 minutes the brain damage is irreversible, and you know that saving the victim is really in your hands. It takes a while to get the blood moving during CPR. Therefore, it is very important to push hard and fast to increase the pressure to get the blood flowing to the brain. Push at least 5 centimeters deep to compress the heart and allow the blood to flow out. A pressure of 100 to 120 times per minute is necessary to keep the blood flowing. Prepare 2 breaths to save the casualty. Hold the first breath for 1 second and observe if the chest rises. Give a second breath if the chest rises. If the chest does not rise, repeat the head tilt and chin lift, then give the second breath. 1 cycle consists of 30 chest compressions followed by 2 cycles of ventilation. Be careful not to take too many breaths or breathe too hard. Continue chest compressions to restore blood flow. 30 chest compressions followed by 2 ventilations. Once the DEFI-5S AED is turned on, it will begin talking by following the voice prompts. You will need to select the mode either for adult or pediatric. You will be instructed to place the pad on the patient's bare chest as shown on the plastic sheet. You will then be instructed to stay away from the patient and not touch him or her while the DEFI-5S analyzes the heart rhythm. Remove clothing from the chest. Open the packaging of the AED pads. Remove the electrodes from the protective film. If the victim is an adult, place the pads on the upper right chest and the lower left chest. There are 2 ways to attach the pads on child. If the child's body is large, Place the pads on the adult place, if the two pads are not touching. If the child's body is small, place one pad on the center of the chest and the other on the back, if the patient's body is small and the two pads are touching. If the rhythm looks like this, you can see that the heart is no longer pumping blood effectively. It is a lethal rhythm and must be stopped quickly. When the DEFI-5S automatic defibrillator analyzes the heart rhythm and comes to this conclusion, it will prompt you by voice command to press the red shock button. The DEFI-5S device sends an electrical current through the heart and back again. The purpose of the shock is to completely stop the uncoordinated heart rhythm for a very short time and give it a chance to return to normal. Always listen to the device and follow the voice prompts, as the heart rhythm may return to normal and therefore a second shock is not recommended. Do your best and do not give up. The DEFI-5S automated external defibrillator gives you the opportunity to save someone's life. DEFI-Soft. The DEFI-Soft is a PC software that supports the reception of data sent via infrared. Reading and setting ECG waves, setting DEFI-5S language and voice volume, reading, analyzing and saving data. Long press of the on/off button turns on the infrared sensor. After selecting the language of DEFI-Soft, enter the serial number of the device and long press the on/off button to activate the data system of DEFI-Soft. DEFI-Soft will display the status information recorded during the operation of the DEFI-5S, including type, event time, description, and ECG waves. ECG waveform gain can be set to 5 mm per millivolt, 10 mm per millivolt, or 20 mm per millivolt. The speed of the waveform can be set to 12.5 mm per second, 25 mm per second, and 50 mm per second. You can also print and save the data.